Okay, students, today's class is on neurodegenerative disorders of CNS. So, the most important neurodegenerative disease is Alzheimer's disease. So, only very few diseases we are going to discuss today. So, the major ones are Alzheimer's and Parkinsonism. So, that will be asked for the exams also. So, Alzheimer's disease, you know that it is a type of disease which leads to dementia. Okay, so it's nothing but a degenerative disorder. What do you mean by degenerative disorder? You mean your brain will be degenerate, like it will be reduced in size. Okay, when compared to the normal brain, you can see the healthy brain on one side. Here in Alzheimer's disease, what happens? Your brain will start degenerating. The cells will start to die. Okay, so that is the major pathology behind Alzheimer's. So it is the most common cause of dementia in older adults. And just remember the important features in pathogenesis, because in pathology, if they ask about Alzheimer's, you have to definitely write these features. Okay, you not remember, you not know every minute details, even the minute pathological aspect in detail, but you should be able to correlate all these things in the histology or in the microscopic findings with the pathology. Okay, so accumulation of two proteins, you have two types of proteins which are accumulating in the specific brain region. So that is the main pathology. Two different types of two abnormal proteins are accumulating in the brain, that is known as A beta and tau proteins. Okay, and what are these proteins, how are these proteins formed in our brain? It is not a normal phenomenon. Okay, A beta and tau are abnormal proteins. How are they formed? See, they are formed as a result of excessive production of these abnormal proteins and also defective removal of these proteins. So, in all our bodies, we have these different defective genes, defective proteins which are formed in a regular basis. But in normal individuals, what happens? Our body's mechanism will try to remove these abnormally folded proteins or misfolded proteins with the help of several mechanisms like ubiquitin pathway, a proteasome degradation, etc., which is യൂഷ്വലി നിങ്ങൾക്ക് അത്ര ആവശ്യമില്ല, ബട്ട് ഇൻ MBBS എല്ലാം നല്ലോണം അത് ആവശ്യമുണ്ട് പഠിക്കാൻ. നിങ്ങൾക്ക് അതിൻ്റെ ഒരുപാട് ഡീറ്റെയിൽസ് ആവശ്യമില്ല, ബട്ട് ജസ്റ്റ് നോ ദാറ്റ് these proteins are defective, and in normal individuals they are usually removed with the help of several mechanisms. But in abnormal patients, or in certain patients who are more prone to develop this Alzheimer's, these proteins will get accumulated. And these proteins will form as plaques. So plaques are one type of aggregates of A beta proteins, okay, in the neuropil material of the brain. So plaque is one of a important lesion in Alzheimer's. And another important feature is tangle. So this plaque and tangle are the hallmark lesions in Alzheimer's. So tangles are aggregates of microtubule binding protein, that is tau. So tangles for tau and plaques are A beta protein. Okay, so the plaques are formed by A beta deposits and tangles are formed by tau proteins. Okay, so that you should remember. Okay, and what happens in advanced diseases, advanced cases, these plaques, these tangles, this leads to a degeneration of the brain tissue, and you can see atrophy of the brain. The tissue itself will be very less. Okay, brain weight will be very less. Okay, Alzheimer's disease, you can see lot of free spaces, whereas the normal brain is more thicker. So there will be cortical atrophy of the brain, and these neuritic plaques and neurofibrillary tangles are the major hallmark. Okay, the neuritic plaques and the neurofibrillary tangle. The plaque and tangles are known by this name: neuritic plaques and neurofibrillary tangles. These terms you should never forget. So they are nothing but accumulation of those A, beta and tau proteins. And another feature of Alzheimer's is cerebral amyloid angiopathy, because there will be deposition of amyloid proteins. You have learnt in your amyloidosis class along with your first chapter. Amyloid is a substance which is deposited in certain defective tissues. So here also there will be amyloid deposition. So that will be the condition of the patient. He will be having severe dementia. He won't remember anything because of this cortical atrophy. And you can see this picture of Alzheimer's with those neurofibrillary tangles which is accumulated in the neurons and certain amyloid plaques, okay, in the brain parenchyma. Okay, so this is a microscopic feature. You can see those tangles and plaques. Okay, so just remember those names and the pathogenesis. That's enough for you. Now next, what is the pathogenesis of Parkinsonism? Have you heard about Parkinsonism? Have you seen patients with Parkinsonism? Parkinsonism is not that rare. You can get patients with Parkinson's. You can see in your neighborhood some older individuals. They are walking, bending forward. Okay, bending forwards like stupor. It is known as stupor, and without any facial expression. So that is known as a mask-like facies and flexion of the trunk. Then in their hands, if you notice, they will have tremor, like a pill rolling tremor. Okay, rolling, the fingers will be like a rolling. Okay, and their steps will be very slow and shuffled steps. Okay, their walking, their gait is known as Festinen gait, or the short sloughing movements. Okay, why this? All these features are due to the defect or the the absence or the deficiency of some material in the substantia nigra of the midbrain. In the midbrain, you have a particular area known as a substantia nigra, and where you have those black material, some blackish area is there, so that's why it's known as nigra. And here in Parkinsonism, what happens? That neurons or the dopaminergic neurons in the substantia nigra is deficient, so that the nigra will turn into a more white in color. So you will get a pale or whitish area over the substantia nigra. Okay. And so, how do you define Parkinsonism? It's a neurodegenerative disease which is marked by a prominent hypokinetic movement. So, again, this is also a degeneration of the substantia nigra. So, what the substantia nigra controls? That area controls the movement of our body. So, basically, here the movements are very less. So, that is very slow movement, hypokinetic movement disorder, which is caused by the loss of dopaminergic neurons from the substantia nigra. So these are the clinical features you may be knowing from your classes, from your other theory classes. So you can take it down. Okay, so here also there is some abnormal proteins which are accumulating along with mitochondrial abnormalities and neuronal loss elsewhere in the brain. Okay, so everywhere there will be some abnormal proteins which are depositing. Okay, now coming to the defective protein, that is alpha synuclein mutation. Okay, so this alpha synuclein is a protein which is getting mutated in Parkinsonism. And what does that lead to? So that leads to the formation of a substance that is known as a Lewy body. This Lewy body is a diagnostic hallmark of Parkinsonism, and this is deposited in certain areas, okay, in the neurons, okay, of the cerebral cortex. You can see this Lewy body. So that is about the neurodegenerative disorders. You have the Alzheimer's and the Parkinsonism. Okay, then I told you there is pallor of the substantia nigra. That is, the substantia nigra will become more pale. Okay. Now coming to the vascular lesions of CNS. So these are all the non-neoplastic conditions. Neoplastic conditions we'll take in the other class. So vascular lesions they have asked as an essay for you. In one question paper you can see the vascular lesions of CNS. I don't know why they have asked this vascular lesions as a essay. That is a 14 marks essay for you. I don't know whether it is that important for you people in your clinical aspect, but because they have asked this as an essay topic, you should take it seriously, even though this topic is not at all relevant for MBB students also. So here only for you people I have prepared this vascular lesions. So you should learn it well because it is asked. Okay, so histopathologically you have different types of vascular lesions, that is AV malformation, venous angiomas, capillary telangiectasias, and some cavernous malformations. These are the common vascular lesions, anything associated with the vessels. So we'll see each of these one by one. What is this AV malformation? That is usually this type of vascular lesion is located supratentorial, that is above the tentorium cerebelli. Its size is about 2 to 6 centimeters. Usually it is single and can be associated with syndromes, some syndromes. And what do you mean by this arteriovenous malformation? You can get different vessels of different caliber. That is, you can see small vessels, you can see big vessels, but all these vessels are coming together. Usually that is not seen in a normal site, normal area. You will get a bigger vessel which goes like that, and then it turns into small capillaries like that. But here in one area itself, you can see arteries and even veins of different calibers at the same site. So that is a type of lesion, a swelling. If it can form as a swelling, or like it can form like a tumorous condition. So, but in grossly, you will see in brain, in one area there will be large areas of hemorrhage with dilated cut sections of the lumen of the blood vessels. You can see cross section of the vessels of varying thickness. Okay. Okay, and usually the patient presents with headache, severe headache because of hemorrhage. It can bleed, no, because it is full of blood vessels, so it can bleed anytime. Okay, severe small trauma itself, it can undergo bleeding. So that leads to severe headache for the patient. Okay, and another important feature is any meningeal irritation will develop seizures. The patient will develop seizures. Okay. Now another important vascular lesion is cavernous malformation. What is this cavernous malformation? Again, it is nothing but a cavernous angioma or a cavernous hemangioma. That is a dilatation of the veins like large vessels, venous channels which is forming a mass. Okay, so that is a well marginated lesion also, very well circumscribed lesion, which is known as a cavernous angioma or a cavernous hemangioma. Now another important vascular lesion is a berry aneurysm. So this berry aneurysms you might have learned in your anatomy classes even. It's very important because it is not that rare. Okay, berry aneurysms are saccular or that is actually a bulge. Aneurysm means nothing but a dilatation of the vessels. So these vessels will be dilated in different parts of a brain circulation, usually in the circle of Willis. You can see the circle of Willis, you studied in your anatomy classes. It's formed by this cerebral arteries, vertebral artery, etc., basilar artery. So anywhere in the circle of Willis you can get this berry aneurysm. So these berry aneurysms are genetically determined. So it's associated with some genetic abnormality. Okay, and that is an important cause of subarachnoid hemorrhage and infarction. So anytime these berry aneurysms can undergo rupture. So if it ruptures, what will happen? Inside the brain, it is situated at the base of the brain, okay? So it can rupture and it can lead to severe subarachnoid hemorrhage, bleeding, and the patient can even die, okay? Or he can go for a stroke or a very bad neurological deficit he can develop. Okay. So what are the common sites of berry aneurysm? You can get it in the junction or in the anterior circulation. It can at the junction between the anterior communicating and the anterior cerebral, in the middle cerebral artery, the bifurcation at the origin of the middle cerebral or the internal carotid artery, then at the bifurcation of the posterior cerebral artery. So all these areas you can get. So 85% is in the anterior circulation, anterior part. Okay, and all these are the sites I told you already. So all these vascular lesions you have to remember thoroughly. You should draw these diagrams of the berry aneurysm also if they ask, because vascular lesions, because they have asked, you have to learn. Otherwise it is not that important topic, but because it is asked as an essay topic, you should remember, because it is not easy to remember also. So different names without any correlation and all. So you have to remember this, you have to read it thoroughly. Okay, so that completes the neurodegenerative disorders. We'll see the tumors and all in another class. Okay, thank you.